Hello and welcome everybody. Today we bring to you the topic of IVF or in vitro fertilization. Infertility is a very common problem in today's world, and IVF brings a ray of hope to people who are dealing with this issue. In fact, we can also call IVF the greatest innovation in the field of reproductive medicine. It has brought happiness to the lives of millions of people across the world and a child to their lives. Today we have with us Dr. Gurpreet Singh Kalra, Medical Director Designate Art Fertility Clinic. On the occasion of World IVF Day today, he will answer some pertinent questions related to this procedure. Welcome Dr. Kalra, it's a pleasure to have you with us today.
Thank you for having me here. The answer to your question, what IVF is that as the acronym is, it is in vitro fertilization. And by definition, it means that you are fertilizing the gametes, the egg and the sperm, in vitro, which means in lab. So IVF is simply the process. I mean, it's a complex process, not a simple process. What it essentially does is that so normally the fertilization for conception to happen, for when a couple conceives or a woman conceives, the conception happens inside the body. The meeting of the sperm and the egg happens inside the body. The conception, they fertilize in the fallopian tubes, and then the embryo starts developing and moves towards the womb and settles in the womb. People who find it difficult to conceive, there can be many reasons. So what IVF does is to provide a chance to conceive, to overcome those difficulties that have been stopping people to conceive. So that is IVF, and the way it is done is that women are given hormone injections in order to create more than one eggs. So normally in a normal menstrual cycle, women release one egg each cycle. But during IVF, the practice is that one tries to get more than one eggs, generally, a good number above one, to improve the chances of conceiving, because the more eggs we get up to a certain number, obviously too much of that is bad too. So you get a good number of eggs up to a certain number, generally between 8 to 15 is considered to be a good range of eggs. You get those eggs, you make the egg and the sperm meet outside the body in the lab, incubate them. Either you let them do their job in the lab in the incubator, or one can help the sperm get into the egg to cause fertilization. And once the fertilization has happened and the embryo is ready, the embryo is then put back into the womb around 3 to 5 days after the egg collection. So that's briefly the process. The egg collection process involves minor surgery where eggs are taken out of the ovaries, and it can be done under general anesthetic or conscious sedation. Once the embryo is ready, the process is to put the embryo back, and that does not need general anesthetic. So your last part of the question was, who is the right candidate for it? That will need a little bit more elaborate answer. The short answer is that depends on what is the reason of people not conceiving. If I give the simplest answer is that anybody who's been trying to conceive, for example, it's a little bit age related, because fertility in women is very age related, because the number of eggs goes down with age. And therefore, for the chance of conceiving either naturally or with IVF depends on age. So if you've been trying, say, for an Indian woman, she's been trying for more than 1 year, they should seek some opinion from a professional or a doctor who's a fertility specialist. And they can then assess whether this is likely to happen naturally or they should take help. I say 1 year, but if a woman is above 35 years, they should not wait more than 6 months, because the time may be then running out. I'd say even from 30 to 35, they have to be a little bit prompt in getting in touch. but under 30, perhaps up to 1 year is okay. After menopause by definition means that they've run out of their own eggs, and normally not. It has been done, and it is not impossible, but it is extremely rare. The only way to do that is to use donor eggs if they are healthy and the womb is healthy, but it will be a very high risk pregnancy with a very high chance of failure.
Okay.
But there are some women, sorry, I'll just like to elaborate a little bit on that. Now, when you say menopause, there are some women who reach menopause in young age. So, which we call premature menopause. Any woman who's running out of eggs before the age of 40 years is classified or defined as premature menopause, which is not natural age of having menopause. Those women have a good chance of conceiving using donor eggs, because the problem there is everything else is fine and fit. They've just run out of eggs. So how long the procedure takes from the start to end is about 2 to 3 weeks. So that is the treatment itself. There will be a period of time when all the investigations are done, all the due diligence is done to see that it is okay to proceed, the woman is fit to have IVF, and we do in-depth investigations to find out what the cause is so that you get the right treatment and therefore have the best chance of conceiving. So that time can take longer, but once the treatment starts, IVF itself takes generally about 2 weeks. And then after 2 weeks, there is a period of 2 weeks till one has to wait for a pregnancy test to see whether it has worked or not. So, but between 2 to 3 weeks to have the treatment itself, and then 2 weeks to wait for pregnancy test, and if positive, then we do a scan in about 3 to 4 weeks after that. So altogether about 6 to 7 weeks of pregnancy. If it is looking good and fetal heart is seen on scan, then that's bingo, that's your success, and then you go on to find further care with an obstetrician. Yes, egg collection procedure is painful and usually requires anesthesia. Commonly in India, general anesthetic is given, while in many other countries, including United Kingdom where I practice, we give conscious sedation, which means it is an intravenous drug given. It is not general anesthetic, and that works well if in some setups. But in India, generally a light general anesthetic is given. There are not many do's and don'ts. People can live their normal life, mostly through IVF treatment. There is, of course, an advice on staying fit, healthy diet, being if those who are overweight, if they can lose some weight before starting treatment, the chances are better and the experience is better. Alcohol probably best not taken during the treatment. And similarly, smoking should be stopped beforehand, because smoking has a long-term effect even in pregnancy. There is more evidence suggesting now that even alcohol, any amount of alcohol can be detrimental. So stopping alcohol intake before starting treatment is good. There is a recommendation to start taking folic acid tablets and vitamin D supplementation before you start treatment, or any woman actually who's trying to conceive should be taking folic acid tablets. 0.4 milligrams is nearly a national or an international recommendation, because if you're taking it before conceiving, it minimizes the risk of certain congenital abnormalities. Vitamin D is also important for conceiving, and therefore should be on board from before trying to conceive. Now, another don't is to avoid hectic exercise, high intensity exercise, but please do carry on with light to moderate exercise. The walks, the swimming, and all is okay. And that's for both men and women. For men, the advice one advice that is important is to avoid exposure to high temperature environments in the last 3 months. For example, some people like sitting in saunas or spas, or work in high temperature environment. The welders, the people working in welding, people working in other industry where temperature can be quite hot in factories and stuff. That should be avoided, or should be the room should be well aired, because and also lying in hot water bath for hours and hours every couple of days is can be detrimental for sperm production. The spermatogenesis required slightly lower temperature than room temperature normally, and therefore it is advised. The other thing is that being intimate is okay until nearer the egg collection time. That the couple should avoid sexual intercourse about 2 to 4 days, about 4 days before egg collection to about the time of pregnancy test. Otherwise, it's fine. So generally, there is not many restrictions, but a few things that I've mentioned are important to be aware of. Yes, and sorry, there was another question you asked after this. We know that there are some anti-sperm antibodies present in some men, which can affect the ability of sperm to fertilize. And it's not a direct mismatch between the egg and the sperm. It is more about the ability of sperm to fertilize the egg. There isn't clear evidence suggesting that a particular type of sperm does not match with a particular type of egg. It isn't. We haven't got that knowledge so far, or evidence to say that there is an inherent mismatch, therefore you can never get pregnant. It's not like that. Again, two parts to your question. One is it rarely successful? I'd say no, it is more often successful depending upon the success rate of the clinic that you're going to, and how well the clinic does their investigation to find out what is. If the clinic does a good investigation and finds out where the problem is and deals with that and acts on that, then the chance of success can be quite high. There are certain conditions where a woman does not ovulate that frequently. There's a problem with releasing the egg every month, and that has a relatively high chance of success. And on the other hand, there are things like where there's no chance of natural pregnancy, where the tubes are blocked, for example. Then you have to have IVF to overcome that. So within IVF, the chance of success in one cycle to get pregnant, for example, at the moment for our fertility clinics, our clinical pregnancy rate is 68% over the last year in our global organization. We are in early days in India at the moment. The data will come out. At the moment, the signs are very promising that we are achieving high pregnancy rate already. I think the second part of your question was how often can one do IVF? There is no set answer to that. It is very individual. There are no fixed numbers that you can try. In fact, because not everybody succeeds in one go, the chance of success overall improves by doing multiple times. And given the right gap and right rest and health being okay, and depending upon the cause of subfertility, multiple attempts are possible. And therefore, that answer is easier given when you have a specific couple in front of you rather than being a general number. There is no prescribed time gap as such, but generally, once a cycle is complete, including all the treatments that can be within one cycle, one would generally take a month or two, have a period or two before starting the next ovarian stimulation. So between two ovarian stimulation cycles, it is advised to have one or two, in fact, at least one, if not two periods between the two. And that is also partly because that gives the woman time to recover psychologically as well as physically, because it is a little bit, quite involving treatment. The chance of having multiple pregnancy, twins or triplets, is higher with IVF than naturally, definitely higher than IVF than naturally. However, lately, as the IVF process has improved, the chance of success has gone up. The practice has moved towards putting in only one embryo back, which is called elective single embryo transfer, which is largely the practice in our service. And therefore, the chance of twinning or multiple pregnancies is really very low. It's in single figures. It used to be traditionally, or in clinics, though, that practice uncritical, putting back more than one embryos to get higher success rate by doing that, are exposing women to a risk of multiple pregnancy of 20 to 30%, which is a very high risk, and multiple pregnancies are high risk pregnancies. So the right thing to do is to avoid putting in many embryos. For example, UK, there is by law a limitation to the number of embryos you can put back, and the recommendation is to put one back. So yes, it is risk is increased, but in the right hands and in the right clinic with the right understanding and investigations, there is only one embryo put back. If you have a good quality embryo, the chance of twinning is therefore very low. Like any treatment, IVF involves giving injections of hormones. There are drugs used. There is, as I said earlier, there's a minor operative procedure involved. There is some anesthetic involved. And all these things will have some risks, but generally the treatment is very safe. The risks are minor and can be easily dealt with. There are no major complications happening generally from IVF treatments. That's rare. It's a very safe. It's a very safe procedure nowadays if done in the right hands and in the right service. For example, I'll add to your question another dimension. You might have thought of asking that. Another risk dimension that has been added to IVF treatments right now in the last 18 months is COVID. So, if somebody catches COVID during the treatment or just before treatment or just after the treatment, that adds to that risk, because then the COVID risk is added to the problem, isn't it? And that has to be taken care of. And our fertility clinics is very diligent about it. We have a dedicated COVID risk minimization strategy in place from very early on. And we strictly adhere to that for both our staff and our patients, so that the risk is, and we guide the patient in the right direction. If there is a COVID happened, we guide when to do your treatment, when is the right time, even around the vaccination, when to take your vaccine, what time. So there's a whole detailed advisory and guidance available for that. I'd like to say that you might have followed up currently with our current association and going on as a campaign. We've had association with Louise Brown, the world's first successful IVF child, and a 43-year-old woman now successfully and fit and well, and has her own 2 children. What I'd say, and the reason for that campaign, is to bring it to people that IVF is a part of normal medical management as for anything else. If you are not conceiving, IVF is a safe, effective treatment. Of course, there are things that can be done before IVF, and if you come to us and you can conceive without IVF, we will advise you accordingly. But if there is a need for IVF, then leaving it too late, actually, you can end up missing the opportunity, because, as I said earlier, fertility in women is very much age related. And if you are not getting pregnant because of an age related reason of infertility, then by delaying it too long, you may miss the boat. So it is always good to get in touch with a good fertility clinic, a good fertility setup where you can get the right advice, and then you can decide. Then you can decide what you want to do. And equally, I'd say that for fertility professionals, the focus should be to advise the patient in an open and transparent way, where a patient understands what's going on and then can make the right decision for themselves.
That was really enlightening, Dr. Kalra. Thank you so much for being with us today.
You're welcome. My pleasure.
Thank you.